Apologize for reading. I normally work off talking points, but this is such a large topic that I feel very strong about, and I've spoken to a lot of my colleagues, other EMS chiefs around the county, to prepare a presentation for you this morning. So again, I'm Evan Resnikoff. I'm the chief of Newtown Ambulance in Newtown Township, and also the president of the Bucks County EMS Chiefs Association. The EMS Chiefs Association is a nonprofit organization that represents the 17 EMS agencies that provide service in Bucks County. On behalf of Newtown Ambulance and the EMS Chiefs Association, we thank you for conducting this hearing this morning. And it's our hope that the information learned at these hearings will provide this panel with needed information to take back to Harrisburg, and hopefully in working with Dylan's office to form a plan to sustain the system for the foreseeable future. So, like safety net hospitals in poor urban areas, EMS is the frontline healthcare safety net. We provide this service without regard to a patient's financial status, without prejudice, and regardless of what the cost is to our agencies. So 10 years ago, I sat before a congressional panel along with 6 of my colleague chiefs in Bucks County to discuss the state of the EMS system. This was held back at Delaware Valley University. And we presented concerns including funding, recruitment, retention, and direct pay legislation. We predicted ambulance station closures, staffing shortages, and financial strain due to reduced reimbursement rates, stagnant Medicare and Medicaid fee schedule, and increased operating costs. And this was before we started seeing the mass closures and consolidations of EMS agencies and the loss of personnel that we see today. So we're now standing at the threshold of a disaster. Since our testimony 10 years ago, unfortunately, all of our predictions, all of our worst fears have been founded. We pleaded for help before the smoke appeared on the horizon, and little help came. In Bucks County alone, we've lost 8 EMS stations since 2004, 4 of which were complete closures of organizations. All this while the county-wide EMS call volume has increased by nearly 20,000 runs in the last 10 years. 2017 was the busiest year on record with nearly 55,000 dispatched EMS runs in our 600 square mile county. In reviewing some Bucks County EMS agency tax returns for the last 3 years, most of the EMS services in Lower Bucks County posted financial losses for at least one of the last 3 years. Several posted losses for 2 of the last 3 years, and in one case, a single year financial loss was documented on their 990 and $150,000. So how did we get here? So like the fire service in Pennsylvania, EMS began as a volunteer staff public service. And I was a volunteer. Many of us older EMS providers all started as volunteers. We were billing for services and had low labor costs, since volunteer staffing was supplemented by a small population of career paramedics and EMTs. We had generous funding from the Commonwealth under the EMSOF, Emergency Medical Service Operating Fund back then, which paid for equipment such as ambulance stretchers, cardiac monitors, and other high-dollar equipment. As a matter of fact, one year, I think our region had nearly $200,000 in EMSOF, and offsetting the cost of buying, $20,000 cardiac monitors when the mandate came out to go to 12 EKGs, which just an immense help. In Bucks County, the transition from volunteer to predominantly career staffing began in the late 90s. And by 2002, most EMS agencies here in Bucks County were staffed predominantly by career personnel and supplemented by volunteers. This transition was nearly silent and faster than anyone could have ever predicted. In present day, only 3 of the 17 EMS agencies have volunteer officers. The rest of us are all staffed by career chiefs, deputy chiefs, battalion chiefs, and supervisors. Grants for EMS are hard to find. For example, the Assistance to Firefighters grant this year had $310 million available, but only $3 million was allocated for non-fire department EMS agencies, and half of that was allocated for EMS vehicles. So the competition for AFG is just intense. 2 of us in Bucks County put in for AFG to replace our bariatric ambulances, and we'll be happy if one of us actually gets awarded it, but looking at some of the awards, I think the chances are pretty slim right now. The EMSOF funding has dwindled to such a low level that we only have enough funds to initiate 1 or maybe 2 regional projects to benefit all the services in the county. All this while over the last 20 years, the scope of practice for EMTs and paramedics has expanded. And while this has allowed for amazing patient care and shorter hospital stays for certain types of patients, this comes at a cost to us that's often not covered by our service-generated revenue. EMTs and paramedics would require continuing intense ongoing training to keep up with protocol and skill updates. Our expanded scope of practice, again, while wonderful for the patient, often requires us to purchase and maintain more equipment on the ambulances. I should make a point to mention that while most municipalities in our region, in the Bucks County region, have increased their financial support by either approving new EMS property taxes or increasing EMS property tax millage, there's still a budget deficit created by following key issues, which are, number one, and this is not necessarily a state issue, but there's been an increase in the number of Medicaid patients, and the Medicaid rate has not changed in years. For example, in Newtown Township in 2016, our average patient age was 69.5 years old, and 30% of our patients are over the age of 85. And we don't balance bill those patients. And Medicaid, there's been an increase in Medicaid patients as well due to a changing demographic in certain parts of Bucks County. And the Medicaid fee schedule is even more abysmal than Medicare. I'm sure everyone is tired of hearing about direct pay, but this is a constant problem for EMS agencies across the Commonwealth. Most of us are not in network as 911 providers for the insurance payers because their contracted rate is far below our cost. There was one agency in 2007 that went in network with Aetna, and that lasted about 10 months. They lost so much money. So what happens now is, for those that aren't aware of how this works, is for 911 service, if you have a commercial payer, you're going to receive a check, and that money is intended for the ambulance provider that provided service to you. But only a fraction of those patients are actually turning the funds over to the EMS agency. Unfortunately, in Pennsylvania, that is not illegal. There are other states within the country where that's actually considered insurance fraud, and it's a criminally prosecutable offense. However, in the Commonwealth, it's currently not, although it's being tested in one county. We're anxiously waiting to see what happens with that. In our case in Newtown, we are owed more than $100,000 this year due to lack of direct pay. That's a significant amount of money. That's 4 full-time EMTs or 2.5 full-time paramedics. Patients that have high deductible health care plans, because it changes with how the health insurance is particularly problematic. Patients in the first quarter or even the first half of the year that haven't met their deductibles are getting the full bill. So they're having trouble paying their bills, and understandably so. You guys have already addressed the payment for treatment for non-transported patients. That's going to be incredible if that passes, because there are quite a few of those patients. And lastly, of course, retention and recruitment. We have a high turnover rate in EMS, as Dylan discussed. EMT hourly rates in Pennsylvania range from about $9 an hour to $20 an hour, depending on where in Pennsylvania you are. Paramedic wages range between $14 an hour and $28 an hour, again, based on location and experience, and the wealth of the community they serve. But here in Bucks County, unless an EMT or paramedic works at least 2 jobs, they can't afford to live here. And that's one of the reasons why we see such an exodus out of our profession. It takes a lot of time and money to onboard a new EMT or paramedic, and it becomes really disappointing that after 2 to 4 years of service, they're leaving either to go into nursing or even another field because they know that they don't have a future. They don't have a future for increased wages. There's no pension plan for non-municipal EMS workers. I've been in EMS for 24 years, and I really hope that my private investments are going to hold value so that I can retire someday. Had I worked for a municipality or had a state municipal funded pension, I'd probably be able to retire within the next 8 years. So what about consolidation? How about that as an option? Well, Bucks County saw its first consolidation of an EMS agency last year, and really it was kind of more of a larger agency taking over the area of a failing agency, but it's consolidating more area under one umbrella organization. And what that experience has taught us is while there is some cost savings in administrative and billing expenses, and it did drive up wages for those who work there in order to retain staff, The service income problem still remains the same. So consolidation, we're gonna have fewer agencies that are gonna bear more of the debt burden. How we're being paid isn't changing, and again, as Dylan said, it's a model that needs to change because it's not sustainable. So instead of having multiple agencies eventually fail, you may have one large agency that's going to potentially fail in the future. So what do we need? And speaking with many of my colleague chiefs in the county, we're still standing at the threshold of the disaster, and it's coming faster than we could ever imagine. If you ask those that live in rural Pennsylvania, as many of you know that have already walked through this door and lost their EMS agencies, a lot of communities are waiting longer response times for ambulance, and mostly for ALS, for advanced life support. We plead to the panel to look within the Commonwealth for ways to fund the public EMS. This is not an easy task. I don't know a lot of the mechanics about what can be taxed, what can't be taxed, but there's a tax on medical marijuana dispensaries, fines from drug offenses, or other sources that may be able to be identified within the Commonwealth. We've got to find some way to help support and fund the EMS system. Again, as the safety net of healthcare, the net's about to fall down, and in many areas it already has. We need to think differently. We are, all of us as EMS chiefs, we're essentially CEOs of 17, or actually we have 17 agencies, we have more than 11 stations, but we have 17 multi-million-dollar nonprofit corporations in this county that provide service to over 600,000 residents. And while we are a nonprofit, that doesn't mean we can sustainably take a loss every year. We need to either have a balanced budget or have a balance with some net so that we can buy ambulances, we can buy equipment. Most of us have cardiac monitors that are at end of life in the year 2021. And the larger agencies that have 7 or 8 cardiac monitors, their average price is about $25,000 for a monitor. You can imagine the capital expense that is. And that's a mandate. Once they're not supporting the device anymore, it's got to go. So I appreciate your time today. Thank you very much.
Thank you. Appreciate it.